tummy tuck or abdominoplasty can very significantly improve the overall shape and proportionality of the patient's body and provide some really lasting changes that not only improve the patient's shape immediately after the surgery, but can provide motivation for further improvement in the patient's overall shape, but also fitness and health. In the past 2 decades, I think that some of the most significant innovations in tummy tuck or abdominoplasty surgery have been the modifications that allow us to really tailor the procedure to the individual needs of the patient. We can do a full abdominoplasty for patients who have significant excess of abdominal skin, or pannus, as we call it, which is Latin for apron. These patients can have skin that hangs over the lower part of the abdomen, and just as with patients who have very large breasts and have rashes and fungal infections during the warm summer months, patients with an abdominal pannus can also have a lot of irritation, inflammation, and infection in the irritated skin in this area. So removing that excess skin or pannus can really improve the quality of their lives as well as their appearance. One of the great things about an abdominoplasty is that it allows us to address all of the different layers of the external abdomen, from the skin to the fat underneath the skin to the muscle underneath that fat, the rectus abdominis muscles. Frequently during pregnancy, those muscles, which are run in a vertical orientation in the abdomen, are contiguous in youth, and then meaning they're side by side. They lay next to one another, and they're gradually pushed apart as the woman's uterus grows in pregnancy. After she delivers her baby, that space between the muscles stays, and there's a general weakening of the abdominal wall. And that weakening of the abdominal wall allows the intra-abdominal fat, the internal fat that surrounds the stomach and the internal organs, to push forward and give the patient's abdomen a more protuberant look. We can repair that gap, close that gap between the rectus abdominis muscles. That gap is called the diastasis recti. And we can suture the edges of those two muscles together to eliminate that space and strengthen the abdominal wall. And in doing that, push back a bit on the internal fat that has been pushing forward to give the patient a tighter, narrower appearing abdomen. And then on top of that, we can remove strategically the fat that underlies the skin to further shape and thin the abdomen and shape the patient's waist. Liposuction is a great adjunct for us in the tummy tuck, and liposuction allows us really to further define the waist and sharpen it, as well as contour the abdomen overall. The incisions for the abdominoplasty or tummy tuck can vary depending on what we're treating. For women who are in good shape and appropriate weight, but just have a little bit of excess skin and fat, we can often keep those incisions rather narrow and low on the abdomen so that they fall below the bikini lines and are inconspicuous. And using liposuction adjunctively can remove the fat through small axis incisions for the liposuction cannula to really shape all the different layers of the abdomen, to remove excess skin and tighten the skin, to remove the fat and narrow the waist, shaping the waist and the hips and sometimes the lower back, and then to tighten the abdominal musculature to give a tighter more sculpted look. I mentioned reducing the fat in the lower back and the posterior flank, and I think that's an important point. Something that we stress is that people are three-dimensional. They're not flat like a desktop. They're like a Coke bottle, and the careful surgeon will continue the shaping not just on the front of the abdomen, but carry that shaping further back and deal with the flanks, the hips, the lower back, the lower abdomen as an aesthetic unit, so that one flows into the other. And that's really where an artistic eye is very helpful. So our goal with abdominoplasty and tummy tuck is to use the techniques that we have at our disposal, integrate liposuction with the tummy tuck, and really address each of the different layers that are affected by aging and pregnancy to deliver a natural, well-shaped look with inconspicuous scars and a quick recovery.